This is my second video in my series for my post-surgery rehab that I'm doing, and I'm sharing with you the things that are working for me and kind of explaining my take on things. If you haven't watched the first video, I recommend that you please do that before watching this one, especially if you're about to have shoulder surgery or have just had shoulder surgery. That video will be more appropriate for you to watch than this. This is the second phase of a three-phase rehab program that I'm going through right now. All right, so basically to catch you up, I had shoulder surgery. It was a biceps tenodesis, and they cleaned up my torn labrum. They did not repair it, and they shaved my acromion bone, which is the top bone of my shoulder here, and gave my rotator cuff muscle more space to function in that area. They also removed several bone chips that were floating around in my shoulder, all of this from a fall that I had while I was trail running. Overall, I'm really happy with my progress, and today I'm going to share with you the exercises that I've been doing after phase one and showing you what my progress is. And just to show you right off the bat, I can now lift my arm up over my head, and that's difficult for me to do, not from a range of motion standpoint, but from a pain standpoint. My shoulder is still quite painful in those upper ranges of motion, and when we get into a range of motion from about here to about here, in physical therapy we think of that as an impingement zone. This is where your arm bone presses up into the top of your shoulder, the acromion, the shoulder bone, the most during arm raising activities. And so that's why that's particularly painful for me. But once I get through that area, I have more range of motion at the very top of my range. So while my shoulder remains a little tight, most of that resistance that I'm getting is from pain. And so it's not a weakness, although there is weakness in the shoulder right now because of the surgery. Pain inhibits muscle function. So I expect my shoulder to feel weak as I'm going, especially through that range of motion, where I have to really fight to get through it because pain is trying to shut down my muscles while I'm doing that at the same time. So that's what that motion is about. We'll show it to you one more time. I can go up here and I can get it way up there. And so my other shoulder is here. Of course, I can move it much more quickly and I have more range of motion, but I'm really close to having very good range of motion. I have very good range of motion, but it's not equal to my other shoulder quite yet, but it's getting closer there. And then lowering that down through that impingement zone is a little painful, but that I expect will go away, in these next few weeks too. Okay, I'm going to take a break here and ask you to please subscribe, like, and share my video, especially if you know someone who's about to have shoulder surgery or just had shoulder surgery. This information might be able to help them out. Thanks. Okay, so let's get into the exercises that I've been working on in this phase two. If you remember from the first video, I hadn't yet done any strengthening exercises. I was just beginning on the day that I shot that last video. And so I've focused a little bit more on strengthening exercises. But again, I did not have a rotator cuff repair done. And so I'm not worried that my muscle strength will be deficient after this shoulder surgery. And so strengthening is not my primary concern with this rehab right now. Range of motion is my primary concern. In phase two, I'm still not allowed to do any active biceps contractions. And so that has limited me in terms of the exercises I can do. So I've been focusing more on rotator cuff strengthening and a little deltoid strengthening too. Now, one of the things that I've been doing since about week 2 or 3 is I've been starting to use my arm more and more for little things around the house, opening cabinets, getting silverware out, unloading the dishwasher, cleaning dishes, and things like that. And if I have to reach up into a cabin, I just try and take my time to reach up there and open the door, the cabinet door, and then, with my other hand, I'll grab the dishes. All of these, even turning on and off the light switch, all of these little activities I feel are helping me strengthen my shoulder and improving my range of motion for the shoulder. So if you have not really been using your surgical shoulder, and remember I had a biceps tenodesis, but I did not have a labral repair or a rotator cuff repair. So this is why I feel I can get away with this. Perhaps if you've had a rotator cuff repair or a labral repair, you might not be able to use these exercises at this point. It really is based on your rehab protocol, and you should consult your doctor or your physical therapist regarding those types of pieces of advice. But anyway, in my case, I feel that the more I can use my arm, the better it is for my shoulder. Now, a caveat to that is I try not to lift things with my palm up. If my palm is up, it's going to automatically activate my biceps muscle, which is still healing from that biceps tenodesis where they move the tendon and stitch it down into my arm bone instead of up in my shoulder. So I'm still restricted with that, so I'm making sure that the movements I'm doing, I'm either trying to have my hand in this position or knuckles up to reduce the involvement of my biceps muscle. And that's kind of important with a biceps tenodesis recovery. Okay, so aside from using my arm more for daily activities, I've been advancing my rehab a little bit more. And you can see I'm wearing a long sleeve shirt now, and I can put on t-shirts and I can put on sweatshirts and things like that. I still have to do that fairly gingerly, but that's okay. Every day I'm seeing a little bit of progress, and I can do just a little bit more. In fact, yesterday was the first day I was able to put my arm up over my head like this, and that was a big success for me. So pay attention to those little victories. I know it gets a little old having, not being able to use your shoulder and having pain and so forth. But if you can focus on the little victories that you have instead of what you can't do, it'll help you get through this rehab process a lot better, and you'll be really happy with your results. Having said that, let's get started on the exercises that I've been doing to improve my range of motion and begin my strengthening program. Essentially, the range of motion exercises are a continuation of what I was doing in phase 1. I'm just doing them further or more aggressively. So if you remember from phase 1, I was doing this all fours rocking exercise to improve my shoulder range of motion, and now you can see that I'm able to lie flat on my stomach on the floor with my arm overhead. This is a shoulder range of motion exercise. It is stretching my shoulder muscles into shoulder flexion. Now, again, this is painful at the top of the shoulder, but that's okay because that's an impingement type of pain. It's not a surgical site pain that I'm damaging anything that was operated on. It's just I'm impinging that area that was operated on, and I find that acceptable in my opinion. So I still don't have the range of motion quite what my other arm has, but this is a great way of going about it. Now, if you cannot lie on your stomach, but you want to advance beyond the all fours rocking, you can simply put a pillow underneath your chest or 2 pillows or whatever to lift your trunk off the floor so that you can lie at whatever angle is appropriate for your shoulder range of motion. So that's what I've been doing for my shoulder flexion range of motion, and I lie there for at least 60 minutes to 3 minutes at a time to really let that stretch out adequately. And after I'm done with that, I can really feel that my shoulder has loosened up really nicely as a result. Now lying on my stomach has become pretty easy for me with my arm up overhead like this, but it's not quite to the point where my other arm is. My other arm I can lift off the ground with no problem and lower it back down, and I want to get to that degree of motion for my surgical shoulder. So to do this, what I'm doing is putting another pillow underneath my arm while it's in this flexion position to further push the flexion range of motion for me. And I can feel that that is a nice advancement for this range of motion goal. Now, let's go into external rotation, because that's the other really tough one that a lot of people will be trying to get. So again, I'm going with this principle that it's easier to move your body away from the arm than it is to move your arm away from the body. On the floor, what I'm doing is lying with my arm in external rotation out to my side, and that was initially very challenging for me. So again, if you need to put a pillow underneath your chest to reduce the torque that external rotation range of motion is demanding, then by all means do that, and you can gradually lower the pillow until you're able to lie on the floor itself. Now, I've progressed to the point where that has become pretty easy for me to put my arm out to the side. So what I'm now doing is putting a pillow underneath my forearm and wrist like this to further improve my external range of motion. So the nice thing about this is that as my external rotation has improved while I'm lying on the floor, I am now able to externally rotate the arm to this degree standing up too. And I was very limited in that. I was able to get to maybe this much here at the beginning of phase 2. And here's the range of motion of my other arm. So my surgical one is still lacking some range of motion, but it's significantly greater than it was originally starting phase 2. So I'm pretty happy with that, and I attribute that improved range of motion to A, using my arm whenever possible during the day to keep the shoulder loose and useful, and then B, the floor exercise of bringing the arm out to the side and using the pillow underneath my wrist to improve my external rotation. That is overlapping into a standing external rotation range of motion, even though I'm not quite there yet. Again, the thing that's stopping me is this is impinging the shoulder and it's a bit painful, and I fully expect that to resolve itself. Okay, so let's talk about the strengthening aspect of my rehab now. So what I've been doing is lying on my side on the floor, and initially, because my external rotation range of motion was so limited at the beginning of phase 2, I used a 1-pound weight and I tried to hold it in a neutral position here with just a little tiny pulse like this, because that's basically all I had to move in this position. Now the key here is you'll notice that in the image here, I've got my hand on my side and my elbow touching my hand. I want to keep the same pressure against that hand as it's moving in and out, rather than allowing the elbow to push in or flare out and things like this. This focuses the effort to my rotator cuff by forcing that pressure to be the same. If my pressure increased as I was externally rotating, then I'm robbing my external rotator cuff muscles of the work that they need to do. So this gave me good feedback having my hand here to allow me to start to progress my strengthening. And as my external rotation range of motion improved from that floor exercise, I was able to start moving my hand further and further away from my body while keeping the same pressure on my hand. So that is pure rotator cuff strengthening while lying down. And then I would also reinforce this by standing up and using an exercise tube, again with my hand at my side, to keep the same pressure on my hand while the arm is moving in and out away from my body. Okay, so reps and so forth. So I didn't really count reps for my rotator cuff strengthening. What I've been doing is just going to fatigue. And so I advanced to a 2-pound weight for my sideline rotator cuff strengthening exercises, and I would continue pulsing that for about 2 minutes, and then my rotator cuff started to become quite fatigued in there. Now the second set, because my rotator cuff muscle was fatigued, I also wanted to develop my shoulder deltoid muscles. And so I decided to combine both the deltoid and the rotator cuff together. And so I'm going to try and show this to you. So on the second set, what I would do is, while I was moving into external rotation, I would also allow the elbow to come away from my body in that sideline position, and then I would lower both in the opposite sequence. So if my wrist first went into external rotation, then my elbow came. So to bring it back down, my elbow would come down and then my wrist comes back down. This is emphasizing the rotator cuff strengthening, but it's also starting to address my deltoid weakness that I've developed because of the surgery too. So this is, I would move slowly. You can see in this video, I'm moving pretty slowly, bring the arm out and then the elbow up. I brought it out to whatever angle I was capable of doing, and then I would bring the elbow in and wrist back down. Wrist first, then elbow, elbow first, then wrist. I would move nice and slowly like that because that focused on motor control of the rotator cuff and ensured that I wasn't substituting with other muscles. Mostly, I wanted to make sure that my biceps wasn't staying involved. So that's a nice way of progressing the rotator cuff strengthening exercises to also include the deltoids if that's where you want to go with things. You can also do the standing up. You'll see here with the tube that if I bring the wrist out first and then the elbow, I can go out to this much and then back in. And so that's the exercise that I also reinforced while standing too. Okay, so we can also use the exercise tube to help us with our external rotation range of motion. So essentially what we do is we use the tube to pull our hand out to the side to improve our external rotation. I find that this is, while a good exercise, it's not as good as lying on the floor and just relaxing into the stretch. When I use the tube like this, I feel more of a kind of impingement pain in my shoulder and on the floor, I feel less of that. I feel like I'm able to turn muscles off while moving into that range of external rotation range of motion as opposed to standing up. You can certainly do both if you want, but I'm just kind of letting you know what my experience is with that. And I still even haven't started doing the pulley exercises for my range of motion yet because I still find a lot of pain moving through that impingement zone that I discussed earlier. So I'm completely happy with where I'm going with my range of motion by using the floor to help me rather than pulleys to help me. And this might be new information for you that you have not been using in your rehab. It might help you speed things along. I find it's easier to improve range of motion if you can relax your muscles into the stretch rather than fighting pain and trying to push through a range of motion physically. That will come later. And again, I'm not worried about that at all. So I'm going to go the path of least resistance with my range of motion, and I find it's really paying benefits for me. All right, so as I mentioned earlier, I'm still not able to do bicep strengthening exercises. I'm really limited with the types of exercises I can do. When I've tried in the past to do scapular strengthening exercises, they're mostly done at the end ranges of my range of motion, so that's been quite painful. So I haven't really done a lot of that. So the thing that I have been doing to start strengthening my scapular muscles is by simply resting on my elbows in a sphinx position. Just resting with your body weight, your upper body weight on your arm and shoulder complex gives a different kind of input into the muscles, the stabilizers of your shoulder joint. And so I did this for about a week, and now I'm able to progress to a plank position with my knees off the ground for 20, 30 seconds. And now I've even progressed today to where I'm doing this on my hands. I've avoided using my hands because that introduces another joint into the equation, my elbow and wrist joints. And so I was a little nervous about doing that, but this morning I was so successful with my elbow planks that I decided to try it on my hands. And as I settled in, it was just fine. So I'll do both the elbow and the hand planks for scapular stabilization moving forward. So I hope this has been helpful, and I wish you the best with your shoulder rehab after your shoulder surgery, or maybe you just have a shoulder injury that you're trying to rehab through. There will be at least one more video of phase 3 of my strengthening program once my phase 2 is done in about another week or two. And so look forward to that.